As of 2015, more than one-third, or 78.6 million U.S. citizens, are obese, according to the Centers for Disease Control. These numbers are only increasing, and many of the obesity-related conditions leading to death can be prevented. The CDC also stated that in 2008, the medical costs for people who are obese were $1,429 higher than those of normal weight. Something needs to be done to stop the obesity epidemic. The 78 million plus people in the United States are dealing with the effects of obesity, both physical and emotional, on a daily basis. First, let's look at what it means to be obese. Being deemed obese by doctors is measured by your BMI, or body mass index. BMI is found by dividing your weight in kilograms by your height squared in centimeters. A BMI of 30 or over is considered obese, or 20% higher than what it should be. One of the reasons our waistlines are swelling is because of our calorie-packed, large portion diets. The USDA reported the average American ate almost 20% more calories in the year 2000 than they did in 1983. A rise in fast food sales also plays a huge role in this growth. According to the World Health Organization, such food makes up 11% of the average American diet. Speaking of diets, fad diets move in and out of popularity just like a McDonald's McRib. The lack of exercise Americans get also plays a huge role in the obesity issue. Americans drive everywhere, sit behind a desk, and then are too tired to put in some overtime at the gym. Now that you see the problem that has arose and why, let's look at some solutions. Society needs to promote nutritious diets and exercise to strive towards healthier living. We can't just command everyone to go on a diet, though. The World Health Organization says it requires an approach that includes promoting healthy eating habits and exercise, developing public policies that promote access to low-fat, high-fiber foods, and training healthcare professionals so that they can support those who are obese and prevent others from falling into that slump. There are also things that you can do to help, like encouraging friends and family to join you in this new lifestyle by suggesting options, like eating more fruits and vegetables, whole grains, spending at least 30 minutes a day exercising in some type of way, and cooking more meals at home and eating out less frequently. Kids learn their healthy habits from their parents. And when kids understand more about the foods they eat, like where it comes from, what it does for them, and most importantly, what they can do about it, they can begin a long life journey of enjoyable and healthy interaction with food. It's important to come together as a community to experiment. Thomas Frieden, the director of Centers for Disease Control and Prevention, said it's crucial for communities to try different things to reduce the obesity epidemic and study the impact of their efforts. We can promote healthy choices at every stage of life. Some communities, like Mason City, are becoming part of the Blue Zones Initiative project, which has made changes to community policy and have engaged citizens, work sites, restaurants, grocery stores, schools, and other community organizations to create a place where people can live longer, better lives, which I got from the Blue Zones Project website. We need to improve school lunch programs while we're at it. Margot Wootan, the Director of Nutritional Policy for the Center for Science in the Public Interest, said that school lunches need twice the fruits and vegetables and whole grains they have right now. We need a nationwide effort to support this, to serve healthier foods and promote students to eat them. The sugary, seductive snacks and drinks and vending machines need to get the boot. If we commit to these solutions, it will lead to a better quality of life for all Americans. If we fix this issue, the dominoes will keep falling, solving problem after problem. Lowering obesity will help lessen health risks for the population. It may reduce the risk of heart disease, including heart attack and stroke, and it may prevent certain types of cancer. It will also save you in America money, like a yellow dot sale at Yonkers. It could save you money on life insurance for a fact. Nowadays, you could be required to hand over your medical costs when searching for life insurance, and if you are at a bigger risk, you're going to pay higher premiums. According to the State of Obesity Organization, estimates for healthcare costs relating to obesity were $147 billion to $210 billion more per year. Obesity is also linked to more absent days by employees, so if we lower the risks, employers will save money. Reducing obesity, improving nutrition, and increasing activity can help lower costs through fewer doctor visits, tests, prescription drugs, sick days, and admissions to the hospital. It is time for individual Americans like you to step up, or maybe jump up, to make a change. Choosing a healthier lifestyle will not only benefit you and your quality of life, but the whole country's. Your family will thank you as well, because being healthy allows you to be the best you can be for as long as you can be. You should set good examples and push the next generation to help pull the United States out of the sinkhole that is obesity.